I'm Terri Bogue. I'm a clinical nurse specialist who specializes in infection prevention. Today we're going to talk about hand washing for the COVID-19 era. Life's changed for all of us due to the risk of exposure to COVID-19 and the importance of limiting its spread. COVID-19 is spread through droplets that escape our mouth and nose when we sneeze, cough, sing, or even talk. Preventing these droplets and the virus they transport from contact with the nose, mouth, and eyes is the key to preventing the spread of COVID-19. Cleaning our hands at the appropriate time and in the appropriate way prevents the spread of the virus that may be found on surfaces from coming into contact with our mouth, nose, or eyes. This also prevents the spread from person to person by touching the same surfaces. Well, let's talk about when and how to wash our hands with soap and water and with an alcohol-based hand sanitizer. Then we're going to talk about the use of gloves to prevent the spread of COVID-19. Now, there are specific times we've all been taught that we need to wash our hands. These times include before, during, and after preparing food, before eating, before and after caring for someone who is sick, before and after treating a cut or a wound, and after using the toilet, or after changing diapers or helping someone else to use the toilet, after we blow our nose, cough, or sneeze, after we handle pets or their food and treats, and after we touch garbage. We all know that, but now there's some other times we really need to pay attention to washing our hands because of COVID-19. We want to make sure we're washing our hands before we touch our eyes, nose, or mouth, after we touch our face mask, even if it's just to reposition it, and after touching items or surfaces that are frequently touched by other people. This might include door handles, tables, gas pumps, shopping carts, or even when we check out and self-checkout. Now, there are times we want to wash our hands with soap and water rather than cleaning them with hand sanitizer. However, you can always use hand sanitizer if you don't have access to soap and water, and make sure we wash our hands with soap and water as soon as we can. Now, ideally, we'd want to use soap and water to wash our hands when we prepare food or before we eat, after we toilet or help someone else with a diaper or toileting, before and after we treat a wound, before and after we care for someone who's sick, after we touch garbage, or if there's just dirt or soil on your hands that you can see. The steps required to effectively wash your hands with soap and water are: you wet your hands with warm water, apply soap to your hands, and then we lather that soap and we rub our hands together vigorously for 20 seconds. First we rub palm to palm, and then we rub the back of one hand with the palm of the other hand, interlacing our fingers. Then we rub our palms together with our fingers interlaced, and we rub the back of the fingers to the opposing palm with the fingers interlocked. Finally, we rub the thumb of each hand, clasping the other and rubbing and rotating it. We rub the tips of our fingers into the palm of the other hand, and we finish by rubbing each wrist with the opposite hand. Then we rinse our hands with water, and we dry them thoroughly with a paper towel or an air dryer if a paper towel is not available. We use that paper towel to turn the water off if the water is not automatic. We use the paper towel to open the bathroom door. Then we dispose of the paper towel. It's easy to use hand sanitizer to clean your hands, and you can use hand sanitizer anytime. Remember the times we just talked about when using soap and water is a better option, though. The steps required to effectively perform hand hygiene with hand sanitizer are: you apply a palm full of product in your cupped hand. Rub your hands together vigorously for 20 seconds. Rub palm to palm. Rub the back of one hand with the palm of the other hand, interlacing your fingers. Rub your palms together with fingers interlaced. Rub the back of the fingers to the opposing palm with fingers interlocked. Rub the thumb of each hand by clasping with the other hand and rotating. Rub the tips of the fingers in the palm of the other hand, and rub each wrist with the opposite hand. Once the hand sanitizer is dry, your hands are safe. Let's talk about the safe use of gloves to reduce the spread of COVID-19 and other pathogens. Many of us have been asked to wear gloves when we're working. Gloves primarily are used to prevent pathogens from entering cracks or cuts on our hands, and to prevent pathogens on our hands from getting into other surfaces, including food we're preparing. Gloves can reduce the spread of pathogens. However, if they're not changed when they're contaminated, they become a weapon for spreading pathogens and illness. Be sure to change your gloves at the times you would normally wash your hands. Cleaning your hands at the correct times in the correct way protects your health the health of your family, friends, coworkers, and customers. Clean hands really do save lives. Be a lifesaver and wash your hands.